Welcome back to Health Check on Newstalk 93 FM. And joining us on Health Check today is Barbara Mooney, a highly experienced professional in infection prevention and control with over 2 decades of work in the field. She holds a Bachelor's of Science in Microbiology and Medical Technology from New Mexico State University, along with a minor in Chemistry and Community Health. Barbara has been certified in infection control and epidemiology since 1997 and has brought her expertise to a wide range of healthcare settings, including acute and long term care, rehabilitation, home health, and outpatient services like dental and physician offices. Her work also includes program management and preparing facilities for CMS, TJC, and DNV surveys. Barbara is a past president of the New Mexico chapter of the Association of Professionals in Infection Control, or APIC, and was awarded the prestigious Gina Pugliese Scholarship through the SHEA CDC course in healthcare epidemiology back in 2008. Currently, Barbara is an executive consultant at ICCNM and serves as faculty for several APIC programs, including API Intensive, the academic, and courses focused on long-term care. She also works closely with the New Mexico Department of Health on CDC special projects covering areas like antimicrobial appropriateness and surveillance efforts such as CLB, BSI, and LABIDC validation. So Barbara is very qualified, and we are thrilled to have you here with us today. Welcome to Health Check.
Thank you so much for having me.
All right, so let's get straight into the conversation. You've had an extensive career in infection prevention and control. Can you take us back to what initially drew you to this field?
Yes, it's really interesting. So I actually didn't know what infection prevention was, and I was always very interested in medical microbiology when I was in the university. And so I started out as a basic microbiologist and then learned about medical technology. And so I ended up working in a laboratory that was in a hospital facility, acute care facility, and we were located right across from the ICU. And so I had the opportunity to meet infectious disease physicians. And one of the physicians was seeing some odd infections, surgical infections with laparoscopic surgeries. And so he needed someone to work on this project with him. I volunteered. And just uncovering the detective work of how these infections happened. And it turns out that the sterilization department didn't know how to disassemble the pieces of equipment, so they were not being sterilized properly after they were being used, and then they were being used on other patients. And so just him uncovering that, I just found that just so interesting and exciting. And so when they had an opening, he said, you should really apply. I think you have a knack for this. And then almost 30 years later, I'm still in infection prevention. And I think what also drew me to it is that I didn't even know we had an infection prevention, or at the time, infection control department. So having a department that had such an impact, but most people were not aware of it back in the 90s, really drew me to that. And I really wanted to raise awareness of the importance of that particular department.
Wow, that's really fascinating, really interesting just hearing the journey there and hearing more about your lab experience and your studying in college, what you did with a background in microbiology and medical technology, and then being exposed to the ICU, and later on community health. How have these disciplines informed your approach to infection and disease prevention and control?
Well, I think that it just brings a different perspective to infection prevention. And I think that that is something that through the years I've really tried to foster in the areas that I've consulted in is that prevention is the key. So, in the microbiology lab, it's downstream. You're identifying organisms, and then there's treatment. But there are many steps that can happen prior to that. So, the basic hand hygiene. You would think that after hundreds of years that we wouldn't be talking about hand hygiene, but it is still the number one area and of education for anyone who works in a healthcare setting or in the general public. I think that we have learned that through the past few years, even with influenza and COVID, and other microorganisms, that washing your hands is primary. And so still getting people to see what kind of things grow on their hands from a microbiologic standpoint. So when I'm teaching, one of the things I do is I show cultures of some organisms like Klebsiella, which are very mucoid. And I, remind individuals of, this is what it looks like in the microbiology laboratory. Imagine what that looks like inside a patient or a resident who has an infection and how difficult it is to treat. So I try to be very practical about my explanation of, where do these things live normally? What happens if they get to places that they shouldn't be? And how can we manage that or prevent that?
I'm glad that you mentioned COVID-19 because that ties into something I wanted to ask you. So, you've been certified in infection control and epidemiology since 1997. How has the field evolved over the last 2 decades, especially in light of global health events like COVID-19?
So that's a great question. And I like to share my story again when we're teaching. We do quite a bit of education as infection prevention consultants. And when I first started in our hospital, we're in a very rural state, and so we're a little isolated. But the first resistant organism that I saw was MRSA, methicillin resistant Staph aureus. And so we had never seen anything of a resistant organism of that capacity. And so how we treated it, and we were so aggressive in trying to contain it. And now when you think about it, you're like, oh, it's just MRSA. Most people, they don't have the same level because we now have things like CREs. We have crab, we have Candida auris. And so with the global network, as we saw with COVID, these things, especially viruses, and we cannot underestimate influenza because H1N1 was very devastating at the time, that internationally we have to know what's going on. We have to prepare. We have to expect what we may be seeing with resistance in other parts of the world and prepare. And so that's one of the things I love about infection prevention as well, is the plans, the preparation. You're constantly preparing for something that could be on the horizon, and it only makes us better as healthcare professionals.
Miss
Uh,
Mooney, before we move on to the next question, I wanted you to give us some layman's examples of the viruses that you just mentioned for some of our listeners who may not have that medical background. So you mentioned a few infections to look out for. Can you give us some layman's titles for them?
Sure. So, carbapenemase resistant or carbapenem producing organisms, it is a type of resistant organism that entire classes of antimicrobials are ineffective against. And so we see different kinds of organisms or genus and species of organisms that are specific to these classes that have gained resistance. And so things like Candida auris, it is a yeast, but it has become incredibly resistant. And that's the thing, is organisms talk to one another. And so it has evolved and it's very hardy in the environment. And you can have over a 60% mortality rate in some of these organisms. And so when you acquire them, either, in the public or typically in a healthcare facility, there aren't antimicrobials that you can treat these organisms with. And then, we know with viruses, many times it's just supportive care. Sometimes antivirals can help, but other times we just have to let it run its course. And that can be very frustrating.
For sure. Working in the hospital as well, seeing things like MRSA, like you mentioned, and other um, resistant organisms, it's very difficult to control, especially when it's acquired in the healthcare setting, when the person's already disadvantaged, already sick, and then they have this healthcare associated illness on top of that. So those are really great points that you mentioned, Barbara. I do want to ask you though, for those who may not be familiar, could you break down what's infection prevention control? What does it really mean in the healthcare context, and why is it so critical? Like we spoke about antimicrobial resistance. What are some other applications in the healthcare setting of IPC?
So a general program is, and I think that this is something that many facilities don't realize, is that there is a plan. You do an assessment of your facility, of the various areas, whether they're ICUs or whoever your population is. You're looking at your demographics, you're looking at your facilities, and you're coming up with a plan because data is everything. We look at what's happening. What kind of surgeries are we doing? What kind of infections are we having? What kind of organisms do we see? Resistant patterns, because depending on where you are in the country or around the world, it's very unique. So they're very tailored. So you do an assessment, you write up a plan of the kind of things you're going to look at. And like I said, number one is always hand hygiene. Um, and then you take a broader look at what kind of things do you see from the laboratory? So things like resistant organisms, what are high mortality procedures or processes that may be going on where you can affect change and protect individuals who either come in with a particular organism, or how do you prevent that from spreading to other individuals within a particular unit. So a burn unit is a great example, or an ICU. You have someone who's very compromised, lots of devices, antimicrobials, lots of medications. How do we keep that from going from place to place? The organisms themselves do not jump. So that means that cleaning and disinfection, hand hygiene, how do we mitigate that? How do we keep that contained? Super important. So educating your staff about their importance, and that's everyone in your facility, from environmental services to your physicians to radiology, your laboratorians, making sure that you're actually getting good cultures, um, places or individuals like respiratory therapy, individuals who may not think that they have such a large impact on patient care and or transmission of organisms is very important. And keeping our healthcare workers well, also, we want to make sure that people aren't coming to work sick. We learned that during COVID as well. Making sure you're either not asymptomatic, that you give yourself plenty of time to recover and you're still not shedding virus. Something as simple as norovirus, which is the stomach bug, that can run rampant through healthcare facilities, through staff, and through your patient populations as well.
Very, very important points that you brought up. Shifting gears a little, looking at like the workforce, for somebody who's interested in pursuing this field, in your experience, what are the most essential qualities or skills that IPC professionals need today?
That's a really great question because we do a lot to promote and retain IPCs. So one of the big thing is I think you have to be curious. And I have to say for myself, I have really grown through the years. I was very shy when I first started. And so I was, a little nervous about going into areas that I was uncomfortable with, but I did have that curiosity. I wanted to know, where were these things happening, identifying trends, going to those areas, and not just what people tell you is happening in areas, but actually seeing it for yourself, assessing their workflows, their physical environments. So I think the big thing is curiosity and knowing what your strengths are and knowing whether you'd be well suited for an individual position where you're a sole practitioner or whether you're part of a team. Because a team, you need everyone. You need those people who are comfortable looking at data and sitting in an office. You need to be comfortable or have individuals who have the phone skills to follow up. You also need those people who are out there in the front lines who are really capable of asking the questions and drilling down and have the people skills because everyone in the facility is really your client as an IP. You're serving them, you're serving the residents, your staff. So curiosity, I think, is the big thing, and knowing that it is ever changing. And I can say that just through my years, I never thought that infection prevention would be where we are today. So much has happened. Um, but it just keeps us on our toes, and you have to be an active learner.
Awesome.
Thank
Thanks for that.
Yeah, I feel that that was a very comprehensive way of explaining that. So given the global challenges of antimicrobial resistance that you've spoken about and healthcare associated infections, what kinds of professionals or multidisciplinary collaboration does the IPC field need right now? So who do you need to also pull into the work to make it the overall impact even greater?
That's a great question. And I think that sometimes is overlooked, that we come in and we help to facilitate. The people who work in, say the ICUs, they are experts in their areas. They know their patient population. They know what equipment comes and goes. They know who they work with. They know about traffic flows. They know all of those things. And so whatever the issue is, whether it's a surgical issue, an ICU issue, um, whether it's something like physician's office, if your facility is associated with that, going there and finding the experts in that area. And so not going in and dictating, but actually asking them, okay, we have this issue. Let's talk about this. Let's talk about your workflow. What do you think? Knowing what you know about this particular organism, what can we do, or what do you know about this, and how can we build a team? Because it does take a team approach. So with antimicrobial stewardship, the primary thing is your culture. If you do not get a good culture, and you're not going to get good results. And so it starts this cascade of maybe organisms being treated that don't need to be treated. And then the resident or patient's normal flora is wiped out, which leaves them susceptible to be colonized with other things, or gaining something as simple as C. diff, which disrupts their gut but can have a huge impact. So using a multidisciplinary team and those people who are actively interested. And you will find those people who will want to volunteer, who want to interject and have value. So I think, you start at the top with whoever your unit manager is. Again, finding someone, maybe a champion in environmental services, because again, they go into every room, they know what's happening. Finding a staff member, and whatever your issue is, finding someone who has expertise in that area. So definitely a multidisciplinary team.
Thank you. Thank you for sharing that, Barbara. So as we talk about everything that professionals need to know to enter the field, what it actually looks like when you are learning about IPC and then putting it into practice. I want to shift gears a little bit to mentorship and the future and, actually spreading information about IPC. So what role do you think leadership and advocacy play in infection prevention and control, particularly when communicating with other healthcare professionals and policymakers?
Well, I think that is definitely a critical component. You need to have the support of your program. You need to know that it is valued. because we are not revenue generating. We are not like the surgical department who bring money into a facility. Our value is in the soft costs. So prevention of mortality, prevention of length of stay. So having that initial support from your administration, it really is quite critical in the advancement of that department and other people within the facility valuing what you bring to the table as well.
Okay, awesome. As we're wrapping up today, I definitely want to ask you, like, what excites you most about the future of infection control, infection prevention and control? Are there any innovations or developments on the horizon that give you hope?
Yes, one, it is ever changing, and so that is exciting to me. Our ability as consultants to go in and adapt to educational needs pretty quickly and to whoever the client is, but nanotechnology, especially when it comes to antimicrobial resistance. Some of the new equipment for cleaning and disinfection that helps with bioburden, some of the testing so that you can test your environment since we cannot see these organisms, knowing that there are different devices that are out there that you can swab and it can tell you if you have a resistant organism in your environment that you may not have been aware of. So there are a lot of innovations that are on the horizon, and I'm super excited, especially, like I said, with the nanotechnology, because maybe that will help us with some of the antimicrobial resistance, because we are not going to be coming up with new antimicrobials anytime soon. So we have to find another mechanism to control these resistant organisms.
Nanotechnology sounds so cool. I'm definitely gonna read up about that some more.
Yes, there's a whole bio engineering component about that. It was something that I learned about a few years back, and it's just ever evolving. Yes, so it's very exciting.
Awesome, awesome. All right, as we are wrapping up today, you spoke about curiosity. Are there any last words that you'd give to anybody listening, anybody out there that's interested in IPC as we wrap up today?
Yes, I would say if you have an interest, at least give it a try. See if you're a good fit for us. One of the things that we do through ICCNM is we are cultivating the next level of infection preventionists. So we actually run courses to have people certified in infection prevention because we know that we are not going to be in the field for forever. And so we want to foster that. So if you have an interest, look at your resources. There's so many out there. And again, just give it a try. See, know yourself, know what your strengths are, and give it a shot. I mean, you'll know pretty quickly whether it's something that's going to work for you. And we definitely need more infection preventionists. We can never have too many in our field because especially with COVID, there were quite a few individuals who retired. So there are many positions that are available, and we need anyone who is excited and interested. And there are a ton of resources to help foster that.
Awesome. Thank you so much, Miss Barbara Mooney, for joining us today, giving us the breakdown on infection prevention and control, what it is, what the day-to-day is like, some career opportunities, and definitely some advice to anybody out there who is interested in this. Thank you guys so much for joining us.